is 12:32. To respect everyone's time, we can go and get started. Welcome. This is the League of Women Voters of Kitsap County's Healthcare Committee meeting, and I'm so excited to have Shannon Turner with us. I'd like to go over the agenda really quick and go from there. And Shannon, you know, I think I mentioned this to you earlier. I did get a couple of emails that some members were not able to come today, but this meeting is being recorded. And my hope is that we could share this with our members. I know several folks were really interested in hearing your presentation, and we're just bummed out that they couldn't be here to join today. I'll go ahead and I'll share the agenda real quick, and then we'll get to hear from Shannon. So this is what our meeting is today. So we will have Shannon talk to us first, and Shannon wears multiple hats. The hats that we'll hear from today are in his role as, okay, Shannon, help me out, medical Respite operations manager, program manager. I think I'm
operations manager. That's fine. Okay,
with Peninsula Community Health Services, but then also Shannon is on the board of the NAACP Bremerton Unit 1134, and he'll also be telling us about his work there, and especially doing outreach for that. And then after that, we'll just give some updates on what's going on in the community. I'll give an update from the Kitsap Public Health Board and some stuff that's going on with the health district. There's been a lot of stuff going on in the news also regarding healthcare we can talk about. I'm also hoping to write an update for our committee for our November voter. And Shannon, the voter is the monthly newsletter for our League of Women Voters up here in Kitsap County. And then I've got ideas also for upcoming meetings that I wanted to share. And I've got ideas for our November and December meetings. So I want to talk about those, get feedback on that, and then I can get moving on finalizing those. So with that, without further ado, well, Shannon, did you want us to introduce ourselves? Like Susan, myself, and Pam, so you know who we are?
Yeah, that would be great. Thank you.
Awesome. Well, how about, I'll go last, but Susan, would you mind going first and then Pam?
Yes, I am the DEI, Diversity, Equity, and Inclusion Chair of the League of Women Voters and a member of the North Kitsap unit, although I haven't gone to a few meetings lately, and a pastor at Tracyton United Methodist Church and a member of NAACP. But again, I haven't gone to those meetings lately, been too busy. So I'll let Pam introduce herself.
Okay. Oh, all right. I am in the unit leader for the North Kitsap unit of the League of Women Voters, and I'm also a co-chair of our voter registration committee, and been on the health committee for quite a long time, and very much appreciate Jessica's getting you as a speaker.
Awesome. Well, thank you, Pam. And Shannon, you know me, so I'm the chair of the healthcare committee, and I also come here with my Kitsap Public Health hat, and I'm the equity program manager there. But then I would like to go ahead now and turn over to Shannon. Shannon, will you tell us about yourself and what you're doing at PCHS and with NAACP?
Sure. My name is Shannon Turner. I am the new medical respite operations manager here at Peninsula Community Health Services. And then I am also currently the second vice president of the NAACP Chapter 1134. A little bit background about myself and how I came to this position. I was student body president at Olympic College for 2 years, 2 terms. And then from there, I became Sherry Appleton, retired Representative Sherry Appleton's campaign manager. And then from there, I moved in to be her executive legislative assistant. And then I also worked with the current representative, Tara Simmons, for a year as well. I took about a 6 months, I would say, break. During that time, I was in the process of moving back home to Ohio. Things did not work there. And my mama said, you know what, the work's not done in Washington. Stay there and continue on doing what you're doing. With that being said, I did that. And at that time, I was a board member for Peninsula Community Health Services. So I walked in, was coming in to turn in my board packet book, and then the executive was here, the EO, and Jennifer Moss. Talked with her and everything. And the next thing you know, I was lucky enough to come on board and become a worker here at Peninsula Community Health Services. This is something as far as health-wise that been involved in ever since I was at Liberty College. One thing I noticed there was the fact that we had students who were homeless. We had students who were going around hungry. And it had students that had certain, behavioral issues as well. So one of the things that I really dug into was the fact that we got a lunch program, a free lunch program, which enabled us to come out, get supplies, get food, and open up a food closet where students could come in. And all they had to do was just show the student ID, they got a free meal for that day. But it also allowed us to make sure that their health and welfare was taken care of as well. So that's really where all this began. And now everything has come to fruition because I continued that when I was at the House of Representatives, because it was something that was really important with Representative Appleton as well. So making sure that the community was aware health-wise of what was available, what was going on, and certain things that were taking place, and certain meetings, but basically hearing from constituents about, healthcare, what concerns and what issues that they had there as well. So coming forth today, I'm lucky enough to be able to be in this current position as medical respite operations manager, to provide an opportunity to the community that will benefit in so many ways. The medical respite operation looks like it'll be a 22-room facility that will allow personnel to be able to stay, and we will work directly with the hospital and then some supporting agencies here within the community and the county as well, such as public health. And what this does with the 22 rooms, it's a medical facility. It's a medical center, so to speak, a medical clinic. And when I say that, this will allow those personnel who are, low income, homeless, or just don't have anywhere to go, or can't afford to go anywhere, the opportunity to come once they get released from the hospital, to come and stay, but yet still be under medical care. And they'll receive medical care where they're, and then there's also the behavioral concerns as well. Well, we'll be able to address and help with those concerns and issues as well. So you're looking at a medical center or a medical clinic that is open 24/7, 7 days a week, 365 days a year for this clientele. But it's allowing them to come in, receive the medical care that they need to continue their health. But also, it will provide them with the ability to speak to counselors if needed, but also have resources at their fingertips. We provide certain, on a level, a certain amount of foods, but it gives them the respect and dignity back to them to let them take care of themselves. It's something that, right now, what's I see as I've been over to Sally's, and I've even spent the night over to Sally's as well. It's just to get a better understanding of how things are, to see things medically, and conditions and everything, and what basically to be on their level, to understand what they're going through, how they're going through it, and how they're getting through it. The biggest aspect of it is the fact that Peninsula Community Health Services provides a dental bus, a dental mobile unit that gives them access to come in to see somebody every week, or to schedule a dental appointment when they have the time or they're there, so to speak. But then we also provide the medical aspect of it too. We have a medical mobile unit that comes to Sally's and provides that, up-to-date medical care that they need, or it allows them the ability to talk to somebody about what's needed and about what they're going through. Wound care, things of that nature, gets addressed. So that's really, really important. And then you also have housing on site at certain times. There are certain time frames. We also provide the legal resources that they need to help them to deal with things on a legal redress, so to speak, for things that have come up. So when you look at this and you look at this respite center that's now going to take place in the old rescue mission building there off of 6th Street, you're looking at providing something that's needed within the community that could possibly change the whole format of how the community looks in this area. Because now you have somewhere where they can go, they can continue to receive the medical support that they need to get themselves better. They're also provided the resources to possibly get housing, because we'll be working alongside with KCR. And then if there is something that, breaks out within the community, we're also, putting rooms aside for public health, for isolation if needed. That could possibly be warranted as well. So you're looking at this respite center coming in and addressing those needs in the area, addressing the medical side of those needs as well, substance issues and those concerns. But I think it's an opportunity for the personnel that would use and be provided with the service a chance to, recover appropriately, possibly move into, housing. And then if they know somebody within the state, we've got a fleet of vehicles. And we're even offering the fact that we can take them to Spokane if needed, as long as they've got somewhere to go, have a roof over their head and meals, to say, okay, we'll get you there. If this is what you need to change your life direction and to help you continue to be medically better and continue your care to put you in the right state, provide you with that opportunity, that's what PCHS is going to do. We're going to be there to ensure that they have every opportunity possible. Again, we have a medical clinic, which is half a block away, another medical center, which is half a block away. So if anything dire does come up, then, there are prescription medication that, we'll have access to. And then, I'm looking at it as some of the personnel we may already know, and some of the personnel we may already be treated. So they may already be in our system. And what better way to have somebody come in that already knows who you are, knows what you're about. It makes it so much easier and so much more cooperative. And knowing that they're secure enough that they have their own individual room, that they're secure and they have the ability to better themselves, which again brings back that self-confidence, knowing that, hey, I've got staff available 24/7 that can handle anything that possibly comes up. Then, of course, if we do have to make the 911 calls, then, that's there as well. So we have that relationship with the fire department and with the police department as well. So, this is really a win-win all the way around. And again, this is the first pilot program within the state, because if you look at the Thomas House, and then if you look at Yakima over in our health centers, they're set up differently and they're tied in. The Thomas House is tied in to Harborview and UW there. And it's entirely different setup because they don't have individual rooms. And the fact that they're still under basically hospital care. So that's a different setup. And then when you look at Yakima and their unique situation is the fact that, they only have they have the room set up, but it's set up differently as far as their care goes and how they're outsourcing everything. You're literally having a medical center on the facilities that is providing care to a certain degree for certain individuals, 24/7. We're trying to be somewhat self-sufficient. We are asking, going out and getting funding for solar, but we're also going and talking to the healthcare authority as well. So there's different things that we're doing to look at funding and how funding is getting going. But our main priority is to continue to be a mainstream within the community, mainstream with our community partners, and to look out for everyone's, better health and wealth in their conditions. So if this goes well, who knows where this will go next for us? Everybody's asking that question, well, what is the next step? Well, let's get through this one first before we move further. But we've talked with the hospital. They're really supportive of this. We've talked with the community. We talked with the county commissioners. They absolutely, they love the idea. Our state representatives love the idea as well. So we've got good support all the way around. So when you look at this, all eyes will be upon us to see Bremerton in the spotlight, but doing the right thing for the right reasons. To help our community grow and get better on all boards across. So for us, this is a great opportunity. It's a great way to introduce and reintroduce the fact that we look at community first and foremost. We look at what we can do to better serve our community and to make our community better. But most importantly, we're not doing it alone. We're doing it with our community partners, and we're bringing everybody to the table. Kind of have the voice and all that, but we definitely have that relationship built outside, and it's bringing in a different set of eyes, because when you look at it, everything in the health industry changes so much and everything. So we've got different types of providers across the board, and we've got dental care as well. So we're in a sense, a new wave and a new stream, because, we're bringing it to you. And we're not going to sit and force anyone, to come in and everything. It's like, if you don't want to come in, we still have our medical units coming over to Sally's. They're more than happy to, jot down the road around the corner to check in with one of our mobile clinics. And that goes medically and everything else. But the opportunity to have the resources there available to you, and the counselors available to you, speak to you on different levels and different aspects of things. It's great. It's a good thing. So that's my PCHS hat that I wear. And as far as for the NAACP, it is something that is really interesting and eye-opening because of the fact that when you are a minority and you go out and you talk to different types of population about it and people, you hear things dealing with, healthcare and the barriers and everything. And it's always something that's been an issue and a concern. So with me on the community outreach portion of it, it's finding out what those barriers are, what we can do to help overcome. And it's the vast information that a lot of people aren't getting. And when they do get the information, it's understanding what that information is and how to use that information to get what is, needed in order for us to be healthy. And that could be, basically the hours of operations at a food bank, baby food for our kids, getting to a doctor's appointment, or even, what the copay is or having a copay to even go. The hours of operations at different locations, what resources really are available for them to use at certain times. So for me, making sure that that they have that information and understanding what that information is. And most importantly, making sure that they understand that they have a right to that. And that's not something that anyone can take away, so to speak. There's other people out there, there's other ways and means to get what needs to be, get what needs to be done, and get what you need in order to make yourself better and your family healthier and better as well. So for me, it's an opportunity to go out and explain, make sure that they have this information and see where they're at, what's needed. So for me, it's wearing both hats is kind of like, well, which one do I turn around and portray at this time, and which one do I turn back around and portray at this time, or wearing them both at the same time? Because with our community, it's a trust thing. It's a trust thing, it's an understanding thing. And then it's a matter of, okay, if I call on you, are you going to be there? And, what you're really telling me? The truth. So, and that's what that trust and building that relationship is. And then once you get to where you need to be, medically at the center, making sure that, they understand what you've been through, what you're going through, and how to help, and not pass that judgment down, because the biggest thing and the biggest barrier that we have is the fact that we stereotype ourselves to the point to where we let fear get in front of us. And it's like, no, I can't take that risk. I just don't want to make that leap of faith just yet. So you got the hand walking through that. And so it's just taking the time to show and understand that, you care about them and what they're going through, and, you are going to be there. And this is the better coverage that you have health-wise. They're not going to charge you. Some of it can be written off. They're not going to turn you away, and they're not going to judge you. Most importantly, they're not going to judge you, and they meet you where you are. And I think that's the commonality of it all, because here at PCHS, we meet people where they are. Every person, every life has a value, has a say. And it's important because they belong to that community and we embrace that community. Well, it's the same thing as I like to say, at the end of RACP. So the two come in hand. And it's an embracement and understanding that, the best thing that we can do is be transparent, be honest, and figure it out going forward. And, to ensure that, most importantly, your voice matters, you matter, and you have a say in your care, because we can't force anything upon you, but we can help you better yourself and better your life if you're given that ample opportunity. So that's the big thing for me in my role as chair for our outreach committee. And then it's just me as a whole giving back to my community. I love my community. I love to help. I love to ensure that people have the opportunity to better their lives, to better their family lives, especially their kids. But that's where our future lies. Because, it takes a village to raise these kids, and it takes a village to sustain a village. It is not just on certain groups or certain people. I mean, if you notice, we all come back and rely upon each other when it gets down and dirty at that dreadful moment. So that's the importance of it all. So with that, I will stop and answer any questions that you have. Oh, yeah, go ahead, Susan.
Shannon, I just wondered if all the clients for your respite center are coming directly from the hospital, or if there are other channels for them to come to you.
Our main tie is with the hospital. We're still working out some details of how that's supposed to work and everything. I know we have certain things that are in place, but we are looking at other ways and means for them to come to us as well.
Okay.
That is something that, we continue to discuss and look over. So until we really, sit down and figure out what that looks like, I can't really say.
Okay,
But right now, if the biggest, I would say right now, the safest thing would be currently, it would be the hospital. But again, we also realize that we have other referrals out there in the area that we're working closely with and everything else. So, but that opportunity is there. It is definitely there. And then, you know, it was kind of, and the thing is that if the hospital doesn't use the rooms at a certain time, then we're looking at it, becoming open. So, if Jessica calls and says, "Hey, look, I've got something, I've got somebody here who needs a room for this amount of time for this reason," sure, I've got a room possibly opening up in an hour. If you can hold on, I can clarify and get back to you, and then it can happen that way. So, but yes, that is something that we're definitely looking at. More than likely.
thanks.
Mhm. You're muted. You're muted. You're muted.
Sorry, Pam, you're still muted.
Okay, sorry.
There you go. Yeah.
I want to have a little clarification on the facility. Now, is that a place that people can stay for a length of time? And if that's so, what are the requirements? And is it a place there that they live? I mean, they can have bathroom facilities and food and what is I guess I'm not clear on that.
It's a 22-room facility. They will have their own individual rooms with a bathroom. I believe a bathroom, a bed, and it's theirs to call. The stay will be up to 30 days, unless they get extended out by the provider or the physician, in that aspect of it. And again, this is, we're still going through to fine tune the process and procedures and everything that we'll have as far as when they come through and in process through us once they get released from the hospital. I know we'll have a medical staff there on site. They'll be able to do certain things that will be required, and it's a daily check-in to be monitored about, how their health is going, what they need, and there'll be certain classes and resources offered as well. So it's definitely a 22 individual room that they will not share with anyone. They will have showers, they will have bathroom amenities in there as well. We're looking at possibly either, TVs or certain pads as far as entertainment goes. And then you'll be able to come and go from a certain time. I mean, it's going to be kind of like Sally's in a sense, mirroring some of those things that they may have, but fine tuning those to just make sure that it meets the medical requirements and requirements that we have for ourselves and everything. So, but it's there for them and those individuals, and it's, like I said, up to 30 days.
And do you coordinate with Kitsap Mental Health and Pendleton Place?
We'll be coordinating with everybody within the region. We will have that discussion with Kitsap Mental Health, as they have, I believe, two respite beds there. We're over there as well in Pendleton Place. So, we've already have established that relationship there. And again, we're already working with the public health department as well, as far as rooms go there. But we'll have established relationships with KCR and the Housing Authority. We'll have other relationships with fire department and the police department as well. And then other neighboring organizations. I know Drayton is getting ready to open up its shelter down the street as well. So, again, our thing is for them to come in and have what they need as if they were in their very own home, to help them better and help them better themselves and get well, but provide certain resources there also that they may be missing or lacking and not aware of. It could be help going out and getting a job where we can partner with KCR on that, or with workforce. And then also there's some things that we possibly partner up with the DSHS as well, with some of the programs that they may have to offer. I don't know if that answers your question or not.
Yeah, it does. You know, 'cause it does. I appreciate that. I mean, I think it's wonderful to have a broad facility that, you know, not just not mental health, but health itself.
Yeah, and that's the key part is the fact that, you know, it's literally a medical clinic inside this facility that's providing the access to what they need to help them get better all the way around. So and that's why I say this is the only program that I know within the state that's really actually, you know, focusing and doing it this way.
Because I know in many instances, a patient can be told, well, you should contact this or you should contact that, and they don't follow through. But when it's right there, then that makes it easier for them to contact the resources. It's a little easier because they usually aren't very proactive.
Yeah, it's a little kick in the joke in the JoJo, as I like to say. But then it gives them the confidence and understanding, knowing that you care enough to be there to provide this. And like I said, sometimes you just have to kind of hand walk everybody through, and that goes a long way. So a little bit of that confidence, and you know, goes a long way because they've been through so much. So you know, a little bit of humility and empathy goes a long way.
You know, Shannon, I mean, navigating systems is hard. And unless you've done it, you've seen people do it. I mean, so hard, especially when you're going through crisis or have other things. So I really appreciate that. And I'm sorry, Pam, I had a couple questions, but did you have any other questions for Shannon?
I have a question for the NAACP side of it.
Okay.
I'm just, you know, because I've been busy registering voters, and I just wondered how you felt about the response of the Black community in particular and other minorities as to whether there's some activation for people to vote. You know, those are the communities, the youth and the minorities of the communities that haven't been as active in voting, and yet it's critical that they be so.
You know, that's a good question, and we are pretty much, you know, we're very nonpartisan with that. I can give you my personal opinion in that area is that when you only see personnel come around and talk to you during a time frame of I need to get elected. I need you to come on board. It's a matter of, well, why? You know, you only come here to have me cast my vote. So this is the only time it really matters.
Mm-hmm.
This is the only time that you really need me. So, and that's across the board for any minority. And then once it's over, said and done, where are you at? What are you going to do? Why are you not keeping your promise? So when you sit and you look at it, when it comes to getting out to vote and registering to vote, there's a lot to overcome. But when you think about it and you look, we're very active. We get out votes in certain ways to make certain things, to get things noticed in our own way, shape, forms, and fashion. Whether that be a dance that takes place, putting on a celebration, and having people come down and get together and say, this is why. Going to church and having it preached from the pulpit. We've come a long way. We're there. It's just that we're doing it in a quiet manner and not doing it loudly. And then it's just a matter of respect and pride. So there's still a long ways to go, but we are making a lot of headway, and our youth are really starting to get involved in that. But it's just a matter of We just got to get through the history of it. And sometimes that's the hard thing to do. But we turned the corner. We showed up. We showed up at the big one. And excuse when I say it like this, but we showed out. And you now have more, well, you have more women, you have more Black women, you have LGBTQ coming out, and they're running for offices. So when you think about it, yeah, so when you think about it, it's a slow progress and a slow turning of the wheel, but it is there. It is getting done. And we consistently talk about it at the NAACP, and we try to do the best that we can. But again, it's going back and getting over that history and saying, your vote is just as strong as the state representatives vote. It even matters more because you have more friends than what this person does. So you can be an influence and an influence maker by establishing and getting registered to vote and voting.
I was curious, do you know Todd Johnson? He did the Vote ER project for Peninsula Community Health Services. He's had, he was down at the Bremerton clinic, and he's done 2 days there, and he's going to be doing 2 more, where the health community, it started by a medical doctor, ER doctor in Boston, saying that patients, particularly going to low-income patients, are less likely to vote, and they need to be more active in supporting better health care than we in our United States offer. So he started this, what's called Vote ER. And Todd was running the one for Peninsula Community Health Services, and they did it, as I say, it'll be 2 more days that he's going to be doing it, where the health provider themselves, they have a lanyard like you're wearing, and they encourage their patients to register to vote. And I was curious if you knew Todd, and he sounds like he's had interaction. They've had interaction with a lot of patients, whether they actually end up registering, because they could do it through a QR easily. I'm just curious if you know Todd. And
I don't know him by name, by face, possibly. I know that was something that they were discussing about doing and how important it was, because again, the two intertwine. And the two intertwine so much because your health and your vote makes the difference.
Yeah.
So, but I know that was something that PCHS wanted to get going, and wanted to really, really get the message out there that just because you are who you are doesn't mean that your voice and your vote doesn't matter. It matters more so now than ever. So, but yeah, but now I will look for Todd.
You have to look for Todd. Tell him Dan sent you.
I'll let him know that when I see him.
Yeah, I know he works out of the main office downtown,
Oh, okay.
Warren Avenue. Yeah, so.
And then, you know, your comments reminded me. So last night I listened to the first half hour of the Bremerton Race Equity Advisory Committee, or REAC. Like Daryl Riley's a member of that, Aaron Leidick, and some other community members. And it was interesting because, you know, in terms of the whole issue about trust. So yes, you know, we need to get people, we want to get people, you know, registered to vote, but it's how our government currently also engages with community, and especially community members who've been underestimated, marginalized, oppressed, and when they come to give input, what happens with that input? And it was really interesting because in the meeting last night in particular, it seemed like government structures were getting in the way of progress with engaged community. It was really, and hearing the frustration, Susan, I don't know if you saw it, but there was a lot of white splaining. Honestly, I felt really bad for Daryl, but he spoke up quite a bit. But it was interesting because, like, you know, oh, well, we've got this Open Public Meetings Act, so we can't do some work on the side. And I think for the past year, this committee, progress has been hindered because of their format and all these, oh, well, you're not particularly a committee, you're an advisory this, so therefore you can't do this. And it's just, it's been so unfortunate to watch as an observer, because you have some really committed community members who have these amazing and also really just bad lived experiences. And just the really weird government structure piece. And there was a conversation, and I think I said this because it was a public meeting, but like, I have a lot of respect for the Bremerton government, but it was interesting how they're, well, we're going to hire an external DEI consultant. But and one of the REACT committee members was like, but we had a community meeting. We gave you input. Why are you looking at hiring an external DEI consultant? And I think that's, and it's a crutch that I think government entities, and we're not alone. So I say we, because I work for government, but it's just fascinating. And it's so unfortunate because it really takes away from that relationship building and that trust when we let and the sad thing about the OPMA is that I think it was created with the best of intentions, open meetings, transparency, but then it this fear of this, then, oh, well, we can't have a conversation about that because that'll be an open meeting if we have more than, 3 elected officials, and then we have to have, so anyway, it'll be really interesting moving forward. And how do we look at how government is structured to better listen to our community members who feel like they've been made voiceless? So I don't know. So that was me on my soapbox, but it was really sad to see this great committee with the best of intentions created, but unable to move forward because of the inability to do certain committees, because of their structure and whatnot. I'm curious also though, Shannon, when it comes to the NAACP side, and I don't know maybe if you've worked with Susan, but if there's any collaboration we can do in the future in terms of voter registration, and it has also been this increase of just nonprofits, like especially BIPOC-led nonprofits in Kitsap County in the past couple of years. But if you have any suggestions, like do you think it would be beneficial for us to reach out, like to NAACP, work together on Get Out the Vote, or
I mean, when you really sit and you think about it, yes, if they talk about DEI, if they talk about equity and whatnot, they should reach out to the NAACP. They should reach out to some type of minority organization that understands this and can speak on that. Because when you think about it, who knows more? Who has the history? You come here, you go to the meetings to get a better understanding of where everyone's at, what's going on in the minority community, and what is the main topic of that that's taking place. But it's also a great place to network and to build those relationships. And the one thing, when I used to live in Paulsville, I would go to the council, it was, you're supposed to be there to represent me. Now, how can you represent me in my community if you don't talk to me in my community? And then how can you sit here and say you want to do this for my community when you just put another barrier up for my community because you don't understand? Why are you not trying to get out and educate yourself and understand what my community is going through, or what my community has gone through, or what I have gone through, and what my history is? So to me, it's the job. That's just like the medical side of things. If you want to understand something medically, contact PCHS, contact the public health. That's what they're there for. That's the best way to build that relationship and understanding, and that's the best way to inform each other of what's going on, how it's taking place, and what barriers is keeping you from reaching out to get where you need to be. So, I mean, across the board, yes. If we talk about community, let's start acting like community and talk to each other and help each other out and hold each other accountable. Be transparent and hold each other accountable, because that's the only way we're going to be able to move forward and do the right thing for the people that we say we want to do the right thing for. So with that in mind, it's definitely, I encourage everyone to attend. I encourage everyone to reach out and just speak and be transparent about everything. Because there you can't go wrong. Because you understand what's taking place at that time moment and what needs to be done, the better the situation. So yeah. And yeah, I agree. Forming a relationship with you guys would be great. It's a great way to build on. It's a great way to network. It's a great way to understand and get a better idea of what the minority communities are going through and how they feel. And then you'd be surprised that you probably know more people than what you think you know, that you've run across. But it's the idea of you need to speak as a whole to get things done as a whole than as a half, because you're only going half the distance and getting half the job done when you do it that way. So I hope I answered your question.
Yes. And then Shannon, with the medical respite center, what is it? And I'm so sorry if you mentioned this earlier. What is your expected timeline for when you want to launch the pilot? Was it 2014? Not 24? Because they're going to be doing some building, right?
Yeah. We're looking at around May of 2024, and everything. We've got another site, another project on that we're taking that we're starting with, which is our Bay Vista project out by Winco. So we're putting that to be kind of like our home campus and another medical center there as well, medical and center, dental center. But we're looking at, around April, May timeframe of 2024, could be sooner, with construction and resources and everything the way they are. That's a good time frame for right now. Hopefully it'll be sooner, but again, we don't know, because everything is so tight when it comes to construction and getting everything in that we need. You have to kind of like order everything about a year and a half out, in a sense, just to make sure that you're able to get it there on time. So.
Yeah, awesome. Well, Shannon, thank you so much for your time. And I learned a lot. And this new center that y'all are working on is just going to be such a big asset to our community, and really appreciate the work and just how laborious the work can be. But it sounds like that, and I really appreciate the work that you're doing. I mean, you're a natural at making, relationships, building bridges with other organizations as well, and not just pushing ahead alone. So I really appreciate the thoughtfulness that you and PCHS are taking with this. Susan, Pam, do you have any other questions for Shannon? Comments?
Go ahead, Pam.
I was going to say, I'm not sure that Shannon is aware of what you have already done, Susan, particularly there when you had the different minority presentations about teaching people about what each one. I thought that was so good. I don't know where your committee's at, because I know you were extremely busy and what it takes to put a production on like that. But I thought they were so good. I assume they're still on our website.
Yeah, we did a webinar with Tracy Flood in order to find out how we could be better allies to the Black community, is probably how we put it at that point. I don't remember exactly. And then we had a webinar, and I may not be doing it in the right order, but we had it with the Asian communities. So we had Filipino, Japanese American, and the Pacific Island nations represented. And then we had it with the Latinx community. And we have one more with the indigenous community. But and I've been trying to attend Tracy's Vital Communications and the NAACP, but of course I'm only one person and it doesn't necessarily get spread around, all the information I learn or the resources or the people, because I'm too busy with all the stuff. And I also am attending the Kitsap race meetings or have been, and with the criminal justice and the education work task force, and trying to do the breaking bread, but that has been the last of my efforts. But I'm just wondering if maybe we should try to have listening centers and go into the community and say, politicians are very good about trying to say, we're going to do X, Y, and Z. What are the things that we need to sort of focus in on your needs so that we can try to do something in a coordinated fashion to try to make help get the politicians accountable to us. I know one of the projects that we have going is trying to help citizens, or not just citizens, residents in the county know how to testify, because a lot of people don't want to go to the legislature and testify, although it's gotten very much easier at the moment, or go to the city council, or go to all the other things. But I haven't had the bandwidth to really organize that, so I'm letting the state league try to organize those. And the plan that they had was to have these available in January. And I thought, okay, we can, see if we can go to an NAACP and have it available to do, or go to Kitsap Arrays and try to get those contacts we have, them better informed, so that then we can spread it out. But I'm just wondering how the DEI committee of the league can partner better to try to work with the minority communities and actually help them to have more of a voice.
Yeah, Susan, I commend you. I don't know how you do and have the strength to do everything that you do. Oh my goodness. It's an honor to be in your presence. Because you're
Well, I haven't followed through as much as I feel like I should, so don't feel honored to be in my presence.
But you got to start somewhere. And I think the listening centers is a good way to start, because that's the biggest thing is the one thing you say is people don't hear me, people don't acknowledge me. So if I can't be seen, if I can't be heard, then who am I? And I think having that opportunity will open it up. Now, you're going to hear some things that you probably don't want to hear, but it's a great place to start. And that's the key, is you've got to start somewhere, because that's what the lack is of, is the fact that it's just disrespect. It's just disrespect, because nobody wants to be accountable for us. And when we try to be accountable for ourselves, we get pushed down, we get pushed back until it's voting season. And then they take the chains off and open up the doors, and it's like, oh, now we're allowed to come out and breathe, so to speak. And but we can't raise our voice too loud. We're still, at a level, but yeah, and then we get pushed back. And that's the one thing I try to tell them. But listening centers is a great place, because we will be there, believe it or not.
No, I think if we partner with NAACP, the NAACP, and do it at Marvin Williams, and
Yeah.
I mean, I think we have to do it all throughout the county.
Yes.
Although Marvin Williams will get a lot of the community, because, have more than one listening session and some choices. Port Orchard probably has some place that would be good. But, I think trying to have a forum, I mean, I know we can write letters to the editor of the Kitsap Sun, we can write letters to legislators, we can write letters to politicians. We have the listening sessions is what I came up with while listening to you. So but yes, we'll have to coordinate with NAACP to try to, and with the Filipino American Association and, some of the other groups as well.
Yep.
But thank you, Shannon.
No, thank you.
Susan, can I make a couple comments? Susan, please let me know. So I'm a North Kitsap School District parent. They actually had their Equity Council meeting a couple of weeks ago. Only 2 parents showed up, and I was one of them. So if there's anything I can do, because I have kids in the system, and I did speak up there, please let me know, because the Kingston Middle School, they have like open house kind of things. I try to participate in that. So if there's anything I can do to help on that front, please let me know. But one thing I also want to note, Susan, with your suggestions of listening sessions, and something I wanted to give an update on as well is right now it seems to be community needs assessment season, and I don't know if you've seen this, Shannon, but and others, but like Kitsap Community Resources is currently doing an assessment. They're actually doing focus groups starting this week. The hospital is doing one as well. The health district is going to be doing one. So I share this, Susan, because I think it'd be great if we can kind of figure out, so we're not constantly asking the same communities questions, because it's tiresome, because like, wait, the health district just talked to me, or KCR just talked to me, and we're not coordinating sharing our results. So something that and I would be happy to update this group on is, so with the KCR assessment, it is an assessment on are people getting various social services. So it does not necessarily call out voter registration, although people can share that kind of information. But the results of that should be coming out December to February of next year. They are doing focus groups, and they're trying to reach different communities. So I mean, last I heard, they've got 2 Spanish-speaking focus groups, 1 mom. I think they're trying to work, and I'm not sure, Shannon, who they're working with. I think they want to have at least 1 African American. And the thing is, we all know that all of these different communities are not monolithic, right? They don't all think the same, and no community thinks the same. So it's just 1 focus group out of potential many. But anyway, so there's that initiative. So that's something to keep in mind, is that some of these groups may have already been tapped. So, and then with the health district assessment, once I know more about that, I'd be happy to let you all know about that too. It's interesting because the health district's also going to be doing a healthcare access kind of thing, and I could tell you guys about that as well. But yeah, and one of the things I think, and I think it would be such a great idea, Susan, if we can do some sort of listening sessions, but also being really mindful about, are we able to act on what is being said? Because I think one thing that can be really frustrating is that people share their wisdom with us and we don't have any authority to act on what they do, then it's a missed opportunity. And that might be something where if we can get Bremerton React, Bainbridge Island React, if we can get other community groups involved, then maybe we can also work together to implement the wisdom that's shared, if that makes sense. Because I just don't want people to feel like, oh, yet another initiative where we get asked a question, but there's no action. And I've heard actually from people like Akuye that, we talk about the problems, but when are you going to see action? So and I can appreciate that too. But that wasn't meant out to poo-poo the idea. I think it's a really great idea. I think just meaning we have to look at that context. But I'm so sorry, Pam, you were going to say something too.
I was going to change the focus a little bit. I was curious as to whether, Shannon, are you aware of public hospital districts?
Not sure.
The concept, public hospital districts, there are 30, I don't know how many, but Kitsap County does not have one. And I'm thinking because of funding for your project, public hospital districts do a lot of different things besides having hospitals. They'll pay for an ambulance corps or a hospice. However, as long as it's related to health, if you have a district, Kitsap County does not have a district right now. Jefferson County does. And Jefferson County Hospital is a public district hospital. They are run by the citizens. There's a board that are elected, and then they direct whatever the need is. There's one out there in Forks. It's very successful, and they have a hospital, but they also have a senior citizen place. When you get older, you can live. Anyway, I was just there's a lot of talk about it now, and I've been on a committee that's been looking to educate people about what they are, and I just didn't know if you were aware of that. I think some issues with what's happening at CHI and St. Michael's now has brought up some concern because hospital districts have to be secular. And when we have some problems there. Obviously, everybody knows about that recently, but that's why there's been a lot of talk. But then I was thinking of Peninsula Community Health Services would possibly have access to, if we had a district, access to that kind of funding. It also, it's usually funded traditionally, Medicare, Medicaid, that kind of thing, and grants. And usually there is some taxation, and that's why the county commissioners are a little bit resistant. But in this study that I've been involved with, where they do have it, the taxes, they are not very high at all. And it helps to fund, again, medical needs in a community.
Right. No, I've heard it mentioned, but I don't know too much about that.
Mhm.
So, but that's something that
We'll keep you informed when we get our videos ready.
okay.
But that's the whole point,
Look
is
forward to
to
it.
educate the community as to what they are and what they can be. And then you have to decide in our county whether we want to have a district or not.
Right. No, looking forward to it. Thank
Okay.
you.
I'll keep you in mind.
Please do. I will help you keep me in mind.
Okay.
Here's where to find. So I want to be mindful of time. So we're now at 1:30. I got a couple things for the agenda. Shannon, you're welcome to stay, but Shannon, thank you so much for your time, and thank you so much for all that you do for the community. You have a lot of name recognition. I don't know if you know that, but when Shannon, like, oh yeah, we know Shannon. Oh yeah, I know Shannon for this. So thank you for your continued service. And thank you for staying in Kitsap County. We're glad you did not move back to Ohio. So
Thank you guys for having me. I appreciate it. And if you
And
ever
one
need
thing
anything, please don't hesitate to reach out and let me know. I'm here to do whatever I can.
And one thing I also just wanted to quickly mention, though, and I was really proud that the league this year had a table at the NAACP Freedom Fund Banquet. I don't know if we've ever done that before. Rochelle helped to wrangle us together. She got the league had an ad in the program, had a table. I know, Susan, you were there, and it was beautiful to see that connection. So I'm hoping that we continue. And I know, as part of the organizing committee for the banquet, we really appreciated the support of the league. So
Yeah.
anyway,
No, thank you, and hopefully we'll see you again next year.
and Shannon can be our MC for that.
I don't know about that, but we'll see. I don't think so. You did a great job. So, I kind of like you being there.
Yeah, Jessica did do a great job. It's
She
great
did.
that you stepped up to the plate.
Yes, she did.
Thank
And she did an awesome job. So very proud of her, and then thank you again. So don't be surprised if you get tapped again next year.
All right, well, I'll look forward to it. Thank you so much, Shannon.
All right,
So,
you guys take care.
You too.
Thank you.
So